I'd like to introduce our next keynote speaker. This is Kari Nadeau. She's one of the foremost experts in adult and pediatric allergy and asthma. She is the director of the Sean Parker Center for Asthma and Allergy at the Stanford University. She studies the mechanisms involved in allergies and asthma to better understand how to prevent and cure these diseases. She has led several international clinical research studies of asthma and allergy disorders. In her keynote today, she will have a look how environmental effects on health revealed by digital health. Welcome with me, Kari Nadeau.
Joined the Davos Digital Forum. I'm here today to give a talk on how digital platforms can be used for environmental exposures and, importantly, for global health issues with climate change. And that's such an important topic, and I'm really excited to be able to be here today among many of my colleagues here to talk about this important issue. So I'll be talking about the environmental effects on health revealed by digital health. And the description is written in front of you that we are currently facing a public health and personal health consequence to climate change. They vary in many different disease areas that are affected by climate change. And importantly, in parallel, we have advances that can track exposures like smart bracelets, smart rings, air pollution readouts, and we can obtain these measurements to help us understand the health consequences to global climate change. And this is so critical because as we think about climate change and the effects on our planet, but also the effects on its people and the effects on children and pregnant women and many people around the globe, we've got to make sure that we use public health digital output measures to help policymakers manage local, national, and international regulations to help us frame and monitor climate change for our adaptation and mitigation. So what do you need to know about digital health systems? Well, it's wonderful that the World Health Organization, the European region, around the World Health Organization are doing a lot of investing in digitalization in health. And we've seen now with COVID that it is very possible to do telehealth visits, to have much monitoring occurring at home through digital health. And it goes beyond just using mobile and internet technologies. It helps make health systems responsive and sustainable, and it's an iterative process to help us monitor people and to have it linked to public health databases. It enables the transition from treatment to prevention, and it's a systems call for modified roles of healthcare professionals to make sure that we, as healthcare professionals, also enable digital health technology to improve the health of our patients and the population. It also can help reduce inequities in healthcare. So what are some of the really exciting features for digital health? Well, for predictions, for example, many of you have already spoken at this conference for the application of digital health solutions, and that can help support healthcare delivery. It can expand our ability to connect with individuals that otherwise wouldn't be able to be connected to in terms of rural health in those areas of the world which it's very hard to get to driving or via Wi-Fi or via connections. It enables us to link up with other healthcare industries like pharmacies, as well as healthcare marketplaces and governments, like I said, to help mandates and to help policy change and to help that information get to those who need it in all different types of languages, and to make sure that this is a perpetuating self-feedback process so that we can metric how well we're doing and we can engage the people using the digital health platforms on the other side so that people can give us real-time feedback to enhance and improve the satisfaction of the digital health platforms. So here's, for example, how we could monitor and evaluate digital health interventions. We can use digital, mobile, wireless technologies to help achieve health objectives. We can use this through information and communications technology, or ICT, both including mHealth and eHealth. And this is something that the World Health Organization has really been moving forward to, as you can see from this figure from one of their reports in 2016. Here's an example of monitoring and evaluating digital health interventions. And this is called Mom Connect in South Africa, where they're evaluating 500,000 pregnant moms, and they're able to get in real time information about how the patient's doing and then use that to have a registry and then create a national database. And importantly, for when that child is born, how well the baby is doing as well. So it's mom, it's baby, it achieves many aims. And this can be included in looking at the environmental, what we call exposome, to overlay the health parameters and the exposure parameters for each of those patients. How does this technology improve service delivery? Well, in many ways, we have the overall registration. There's more systematic approaches to collecting, especially in populations where there's inequality and access to healthcare. This allows us for decision support, for education, and improving adherence to care and utilization of that care with high quality and efficiency and to reduce costs. Why are all these important for climate change? Well, we know, and especially here where I live in California, there's a lot of issues around wildfire and air pollutions. And we luckily work with a company called Purple Air, which many of you might know from around the world. You can have this device attached to your house as well as inside your own home. You can get outside and indoor air quality assessments. Why is that important? Because air quality can be seen as small particulates that can get into your lungs, even smaller than a human hair diameter, that can get into your lungs at PM 2.5 microns. We call that particulate matter 2.5. And we can monitor those exposures through this Purple Air device, which is an example of digital health. Here's an example of the Bay Area where I live and the Purple Air monitors that have occurred. And you can see this can be easily traced then and picked up by a digital health monitoring system. And the importance of this, I'll show you on the next slide. But before I show that, I want to explain the global burden of air pollution so that if all countries were to enable households to collect via their Purple Air or another device the air quality, it would help us really monitor air pollution, because here we are reliant upon each country's exposures and what they document to be the exposures. And the reason why this is so important, because air pollution and wildfires and other aspects that are occurring throughout the world with climate change, water pollution, air pollution, earth pollution, all of these things can be monitored now thanks to digital health. And air pollution is responsible for many deaths. And so that's why I want to frame it today for our digital health. In California especially, we've seen an increased rise in wildfires, and climate change is causing that. Most wildfires are caused by people, but the global warming and the increased temperatures and the droughts, and because we have much death of trees, we are now seeing a rapid rise in our ability to have wildfires. And unfortunately, some of the very same places that are meant to help us, like this is a hospital in Paradise, California, which is one of the first buildings that burned in the wildfire there. When we look at air quality index, we look at a number of different features, and this all pertains to PM 2.5 and other units of measurement that we look at. But one cigarette, for example, is 22 air quality indices. So when you look in the hazardous range, that's equivalent to about 25 smoking cigarettes a day. So when you look at some of the Purple Air information that we've collected during the wildfire season, here is a roadmap of the Purple Air features that we were able to get through digital health and through public health analysis. We were able to overlay that on which counties were suffering the most asthma, for example. And for those areas that had the most air pollution and the wildfire exposure, those were also the counties that had the most asthma issues. And this can be brought to many other items on the digital health platform, from looking at pollutants, because we know that increases not just asthma, but lung cancer, respiratory infections, ischemic heart disease, COPD. So that if we were able to link the digital health exposure analysis of air pollution and public health domains and personal health domains on people and their reaction and their healthcare, we could really find out the linkage between exposures and outcomes in health. And this is critical for our knowledge of how we can improve climate change policies, and adapt and mitigate to climate change. There are many public health concerns, and the EPA in the US is also involved in this. So you can see again the list of symptoms that are associated with air pollution. My colleague, Sharon Chintaja, as a digital solution that is now bridging the gap in asthma. She's done a fantastic job of using this at Stanford to be able to understand the patient monitoring systems, the patient physician visits, and then also understanding and educating people on asthma. And this has really helped not just for education, but also public health benefits to overlay, like I showed you, the wildfire exposures and the relationship to asthma incidence around our state. And so this can be brought forth in any part of the world, but importantly, it also helps individual patients with wearables, with electronic medication monitors, and with educating in their home. And it also helps with racial justice. So to be able to, again, have that presence and that mindset for making sure that we're equitable across different cultures, across different speaking languages, and across different socioeconomic strata. And that's very helpful for being able to make sure that we have digital solutions for everyone. I want to thank you for your participation today. We have a big vision for our center here at Stanford, and that is to help all people in the world to be able to get access to good care and to be able to understand global climate change and use the features that we learn in digital health for exposures and for air pollution to help people and their health. We also want to make sure that we can help people on the mental health aspect. Many issues around global climate change affect anxiety, and we're hopefully helping with virtual reality testing to help people reduce their anxiety in asthma, allergies, and many other diseases. This is an example of us using mobile apps for people having their asthma and being treated for their anxiety as well as other features of their healthcare, because we want to help the whole person. We're also working with another digital health platform at Stanford in the Bay Area with a company called Kari, so that we can put a monitoring system at the bedside and understand if someone is wheezing or having issues even at night when they're sleeping. So I want to thank all of you for your attention today. Appreciate the families and the teams of collaborators that we've worked throughout the world. And I'm excited to be able to be here today. And thank you again for inviting me. Thank you.